What are the signs and symptoms of ovulation? If you can track the symptoms for at least 3 months, you are likely to identify the pattern. Below we list some of the symptoms that most women have during their ovulation. 1. Increase in cervical mucus. The volume of cervical mucus is observed to be increasing from 9 days before ovulation, and peaks from 4 days before ovulation. It resembles egg white and turns slippery during this time. 2. Rise in basal body temperature, BBT. The BBT comes down just before ovulation and sharply rises after the ovulation is over, due to an increase in progesterone level. The rise in BBT confirms that the ovulation has occurred. By the time you know about it, it would be too late to conceive in that cycle. But it will help you track the ovulation days, and prepare for the coming months. 3. Changes in the cervix. The cervix that is relatively low with a small opening will move higher, gets softer and widens. For feeling the cervix, you can insert your clean finger into the vagina until you feel a little nub. You may have to do this every day to know when it opens. Secondary ovulation symptoms. Secondary symptoms do not occur all the time. However, when you observe any of the 3 primary symptoms, you may check for the secondary symptoms too. In fact, the secondary symptoms are easier to spot than the primary ones. Light spotting. Some women experience mid-month pinkish or brownish spotting when the production of the progesterone hormone is not enough to keep the lining intact. Progesterone usually thickens the uterine lining that is released during the period. Inadequate secretion of this hormone could result in spotting. Pelvic pain. You may have cramping and pain in the lower abdomen on one side of the pelvis. This pain is referred to as Mittelschmerz, a combination of German words that mean middle pain. However, it might not occur right during ovulation and cannot be regarded as a definitive ovulation symptom. Sore breasts. Hormones stimulate the breasts to retain fluid that causes them to slightly stretch out. This could lead to tender, sore and heavy breasts. However, you may not be sure about ovulation based on this symptom, as the breasts may turn sore even during PMS and pregnancy. Bloating. Just as the breasts retain fluid, the abdomen can also retain water and make you feel bloated. However, fluid retention could also peak on the first day of menstrual flow. Increased libido. You may experience an increase in sex drive due to high estrogen levels leading up to ovulation. However, this may occur even during the luteal phase, that is after ovulation. Pleasant body odor. In a study, men were asked to smell the t-shirt worn by women during the follicular, ovulatory phase and the luteal, non-ovulatory phase. Men found the odor of ovulatory phase t-shirts more pleasant and sexy than those worn by women during their non-ovulatory phase. Increase in pulse rate. Resting pulse rate, RPR, increases in the days leading to ovulation. It is the lowest during periods and increases around 2 to 5 days before ovulation by around 2 beats per minute, BPM. These symptoms are not obvious. You need to keenly observe them to know if you are ovulating.